Which of the following best describes heparin resistance during cardiac surgery? A. Failure of ACT to reach greater than 300 seconds after standard heparin dose. B. Elevated APTT despite high ACT. C. Bleeding despite adequate ACT. D. High fibrinogen despite heparin administration. Answer: A. Failure of ACT to reach greater than 300 seconds after standard heparin dose. Explanation: heparin resistance is often due to antithrombin 3 deficiency. It is suspected when the ACT does not adequately prolong after a standard heparin dose. What is the most appropriate treatment for heparin resistance during CPB? A. Additional protamine. B. Platelet transfusion. C. Antithrombin 3 concentrate or FFP. D. Warfarin. Answer: C. Antithrombin 3 concentrate or FFP. Explanation: since heparin requires antithrombin 3 to exert its effect, supplementation with AT3 concentrate or FFP, which contains AT3, restores responsiveness. Which of the following is not typically included in point-of-care coagulation monitoring? A. TEG, thromboelastography. B. ROTEM, rotational thromboelastometry. C. INR. D. Platelet aggregometry. Answer: C. INR. Explanation: INR is a lab-based test and not typically used as a point-of-care test during surgery. TEG and ROTEM offer rapid bedside functional assessments of coagulation. What does the R time on a thromboelastogram, TEG, represent? A. Fibrin formation speed. B. Clot lysis. C. Time to initial clot formation. D. Platelet contribution to clot strength. Answer: C. Time to initial clot formation. Explanation: R time is the time from test initiation to the beginning of clot formation, and is prolonged in coagulation factor deficiencies or heparin effect. Which of the following transfusion thresholds is appropriate for hemoglobin during cardiac surgery? A. HB less than 10 g/dl. B. HB 9 g/dl. C. HB 8 g/dl. D. HB 7 g/dl, unless symptomatic or bleeding. Answer: D. HB 7 g/dl, unless symptomatic or bleeding. Explanation: restrictive transfusion strategies, HB 7 g/dl, are supported by evidence, unless the patient is symptomatic, bleeding, or has risk factors, e.g., coronary artery disease. Why is normothermia often targeted post-CPB during the rewarming phase? A. To reduce oxygen demand. B. To reduce risk of seizures. C. To enhance clotting function. D. To prevent arrhythmias. Answer: C. To enhance clotting function. Explanation: hypothermia impairs enzymatic clotting reactions. Rewarming to normothermia helps restore coagulation and reduces bleeding. Which product is indicated for massive transfusion and fibrinogen replacement in bleeding post-CPB? A. Platelets. B. Cryoprecipitate. C. Albumin. D. Heparin. Answer: B. Cryoprecipitate. Explanation: cryoprecipitate contains high concentrations of fibrinogen and is especially important in massive transfusion or when fibrinogen is less than 1.5 g/L. What component is typically deficient in CPB-induced coagulopathy but not corrected by FFP? A. Platelets. B. Factor 2. C. Factor V. D. Factor 8. Answer: A. Platelets. Explanation: FFP contains all coagulation factors but no platelets. Thrombocytopenia and platelet dysfunction are common post-CPB and require platelet transfusion. What is the most common cause of heparin rebound after cardiac surgery? A. Low fibrinogen. B. Inadequate protamine dose. C. High platelet count. D. AT3 deficiency. Answer: B. Inadequate protamine dose. Explanation: heparin rebound occurs when the protamine dose is insufficient to neutralize all circulating heparin or due to redistribution of heparin from tissues. Which of the following is most effective at reducing intraoperative bleeding during cardiac surgery? A. Albumin infusion. B. Erythropoietin preoperatively. C. Tranexamic acid intraoperatively. D. Furosemide infusion. Answer: C. Tranexamic acid intraoperatively. Explanation: Tranexamic acid is an antifibrinolytic that significantly reduces perioperative blood loss during cardiac surgery, especially on CPB.